My name is Kathy Barnard, President and founder of the Save Your Skin Foundation. It is with pleasure that I welcome you to the 5th Annual Patients Redefining the Future of Healthcare in Canada Summit. On behalf of the organizers, Save Your Skin Foundation, the Canadian Psoriasis Network, and Sharon Clark, Associate Director, Office of Indigenous Initiatives and Office of the Provost and Vice Principal Academic at Queen's University. Also, thanks to the Conference Board of Canada for joining us to organize the Value-Based Healthcare panel. I would like to begin by acknowledging the Indigenous peoples of all the lands that each of us is on today. While we meet on a virtual platform from coast to coast to coast, we acknowledge the ancestral and unceded territories of all the First Nations, Inuit, and Métis people that call these lands home. We confirm and affirm our commitment and responsibility to improving our own understanding of our local Indigenous peoples, including First Nations, Inuit, and Métis, and to improving relationships. Please join me in a moment of reflection to acknowledge the harms and mistakes of the past that continue, and to consider how we can each, in our own ways, move forward with meaningful efforts of reconciliation. I would also like us to remember those who have lost their lives over this past devastating year. Whether or not directly or indirectly from this pandemic, we miss them all. I send well wishes to those who are ill and wish them a speedy recovery. I heartily and sincerely thank first responders and other healthcare workers who have and still are working long, difficult hours on behalf across this country and in other countries as well. Never have the issues of sustainability and effectiveness of healthcare systems and delivery models been more in the forefront of people's minds than they are today. Never have patients felt more that they need and are entitled to a meaningful voice in the future of these systems upon which their welfare, in fact, everyone's welfare, so profoundly depends. Let's be clear, serious problems with the healthcare system have existed long before this pandemic. Those of us engaged with that system on a regular basis have known it and have been surrounding and sounding the alarm bell for a long time. The pandemic has exacerbated these problems and has probably created some new ones. Sadly, now the general public knows this terrible reality. This summit has always recognized the need for real change led by patients who know in real world terms what we need. In previous years at the summit, we have worked together to determine how this real change should be achieved by and for the benefit of patients and their supporters, and actual for all populations across this vast country. We have concluded that only a value-based system tailored to Canada and resting on a strong foundation of outcomes that matter to patients, enabled by relevant evidence from consistent, connected, and confidential data, and managed through integrated models of care focused on serving specific populations, will ensure that everyone across our country receive the health care and health outcomes they need and deserve. Our collective experience during the pandemic is an important overlay to these pre-existing underlying problems. It requires us to look ahead with additional information. What will virtual care mean when widely implemented? How do we ensure that health systems provide needed access and positive outcomes for all people across Canada? How do we ensure that those who have often been left out of proper planning and implementation of our health systems are included? How do we ensure that Indigenous peoples lead and have their own distinct voices heard in a meaningful way for their healthcare solutions? These are questions of utmost importance for patients and people in general at this time. Over the course of this summit, we will explore these questions with a host of experienced, staged, keynote speakers and panelists. We will take in their wisdom, and as in every other year, we will develop and amend existing action plans. I would agree that by the end, we may well conclude that our healthcare and delivery systems, like an old house, cannot just be renovated, but must be rebuilt from its foundations. We could not host this event without the support of our sponsors, all of whom provide unconditional funding and other resources to let patients plan, develop, and implement this summit entirely independently. In alphabetical order, thank you to Amgen, AstraZeneca, Bristol Myers Squibb, GlaxoSmithKline, Janssen, Leo, Merck, and Novartis. Thank you, Innovative Medicines Canada, for support of our 2020 working groups. Thank you to the Conference Board of Canada for sponsoring the Value-Based Healthcare Panel on December 8th. Thank you, Rena Ruparelia, for breaks. Thank you for our breakout group facilitators, Ron Rosnes, Cheryl Ann Semano, Eva Villalba, Leah Stevenson, Madge Ganban, Christina Sitch, Martina Elias, Sharon Clark, Monica Slovenka D'Angelo, Joanne Harabas, Stephanie Michaud, Nicholas Monozo, Isabel Morozo, and Lori Cameron. Thank you for your wonderful working group leaders, Eva Villalba, Chanel Pathak, Johanka McPhee, Jennifer Graham, Margaret Peters, and the members of each of our 3 active working groups this year. Integrated models of care, data, and patient-reported outcomes measures. Thank you to Rentree Productions for the AV support. Thank you, Leah Stevenson, for strong backbone support for the activities of the working groups and Summit Steering Committee, and the amazing facilitation I know she will do. Very special thank you to Chantal Burrows for logistics and administrative support, as well as Natalie Richardson, Liz Bono, and Marianne Gagnon, the amazing Save Your Skin Foundation team. And last, but definitely not least, thanks to our hardworking and stalwart steering committee members, Antonella Scally, the Executive Director of the Canadian Psoriasis Network, Louise Binder, the Health Policy Consultant at Save Your Skin Foundation, and our newest member and contributor, Sharon Clark, Associate Director, Office of Indigenous Initiatives and Office of the Provost and Vice Principal Academic at Queen's University. Also thanks to Monica Slovenki D'Angelo, Director Health at the Conference Board of Canada, for joining us to organize the Value-Based Healthcare Panel. And most of all, thank you to all of you for joining us. Have a stimulating and inspiring summit experience. Thank you.